This is for Medtones Unit 7, Activity 1. Diseases of the integumentary system by COA. So, the first disease is psoriasis, which affects about 2 to 3% of the global population and can appear at any age. It typically develops in early adulthood, and it is an autoimmune disorder with genetic components. Certain genes have been linked to increase susceptibility, and for no treatment options or topical therapies, phototherapy, and systemic medications. And it can affect a patient's quality of life as it can lead to depression, distress, and social stigmatization. And it now patients with psoriasis have a chronic autoimmune condition which causes rapid skin cell growth, resulting in thick red patches covered with white scales. It can affect any part of the body, but it most commonly affects the elbows, knees, and scalp. Symptoms may include itching, discomfort, and it can flare up due to stress, infections, or weather conditions. And our next disease is eczema or atopic dermatitis, and it is the most common skin condition affecting about 10 to 20% of children and 1 to 3% of all adults. It's a combination of genetic, environmental, and immunological factors. Patients often have a compromised skin barrier, which allows for irritants and allergic reactions. Treatment options include moisturizing, topical corticosteroids, antihistamines, and immunomodulators. It has a significant impact on quality of life, with children having a higher risk of allergies to things like food, and they can experience hay fever and asthma because of it. And patients with eczema will have a inflammatory skin condition which has red, itchy, and inflamed skin. It often begins in childhood and is often associated with things like allergies and asthma. Triggers can include soaps, fabric, food, and environmental factors. Next up, we have acne. It is another very common skin condition, especially in the United States. It affects up to 50 million US citizens annually. And it's often caused by hormonal changes, oil production, clogged pores, bacteria, or inflammation. Treatment options: over-the-counter medicine, or prescription medication, and hormonal treatment options. It can cause psychological issues such as low self-esteem, anxiety, and depression. and has the possibility of leaving long-term scarring. And patients with acne have a disorder of hair follicles and oil glands, which lead to the formation of blackheads and whiteheads, papules, pustules, and sometimes cysts. It is most commonly seen during adolescence, but it can affect any age. Factors such as hormonal changes, diet, and stress are known to contribute to its development. Um, Finally, we have melanoma, which is 1% of all skin cancer cases, but does lead to the majority of skin cancer deaths. Um, it appears more in fair-skinned people. Um, it's caused by UV exposure from things like the sun or tanning beds, um, or it can be because of family history of having melanoma or having atypical moles. Treatment options are removing it surgically in its early stages, um, with more advanced stages requiring things like chemotherapy and targeted therapy, and it has a big impact on life. Early detection of melanoma is very important, with advanced stages often leading to death. Patients with melanoma, they have a very serious form of skin cancer, which comes from melanocytes, which are these cells that produce your melanin. It often manifests as a new or evolving mole or darker spot on your skin, and potentially it exhibits irregular borders, multiple colors, or asymmetry. And early detection is critical for effective treatment.